you take
Yeah.
on debt, you pull credit cards to make it work. And
Yeah.
so I think if you know in your core that you're an entrepreneur and that's your personality and you have the opportunity to do something, and I say go for it. That's my biggest
Mm.
advice.
Welcome to the Full Fueled Podcast. Welcome to the Full Fueled Podcast. Welcome to the podcast with your host, Matt Tack, with your host, Matt Tack.
Your host, Matt Tack.
Who are you?
I'm Dr. Alfred Alessi.
Dr. Alfred Alessi.
Dr. Alfred Alessi.
They know by now, bro. They know by now.
I'm going to set what the new normal looks like in my life.
You're not limited by your genetics.
You have a superpower that is lifting people up. And dude, you
The
real.
only way we're going to get the word out is with you. Live full fueled, live beyond limits, baby. Let's go.
Welcome to Practice Talk, a podcast for healthcare practitioners seeking business support, information, and connection. I'm your host, Jesse, and I'm thrilled to have you here today. Through my online programs and personalized guidance, I help practitioners and clinic owners from all over the globe achieve their goals and build successful, thriving practices. On this show, we will be interviewing inspiring professionals who have faced their own hurdles, have been able to overcome those hurdles, and continue their thriving practice journeys. On our solo cast episodes, we will be answering questions directly from our thriving practice community, so we make sure that we are covering topics that have direct meaning to you and your practice. Whether you are a seasoned practitioner or just starting out, Practice Talk is your go-to resource for knowledge, support, and building a community. Practice Talk starts now.
Today we meet with Dr. Alfred Alessi of Alessi Functional Health. Dr. Alessi is an integrative health practitioner, doctor of functional nutrition, and a corrective chiropractic care specialist with over a decade of experience in the world of health and wellness. Dr. Alessi found chiropractic through his own personal experience, and I'll let him tell you about that on this episode of Practice Talk. Yeah, nice to meet you.
Nice to meet you as
Dr.
well,
Alessi,
man.
how's it going?
Yeah, good. That's
Yeah.
cool studio.
Thank you. Yeah. We do a couple of things here. Me and my wife also have like a parenting podcast we do, so
Nice.
multifunctional.
Yeah,
Yeah, I like
yeah.
your background as well. I like the blue.
Appreciate it. Yeah, I'm just in the lobby of my office, so
Oh, awesome.
worked out well. Yeah.
Sweet. Well, tell me a little bit about your practice.
Yeah, man. I'm located here in Tampa, mostly corrective care, chiropractic
Mhm.
biophysics based kind of clinic, but over the last couple years have added a ton to the office.
Yeah.
Spinal decompression, soft wave therapy. Just brought on an associate doc who does acupuncture and cupping
Mhm.
and that kind of stuff. And then we had a room in the back that was like more of like a rehab stretching area, but
Mhm.
we turned it into a spa. So it's got a sauna and
Oh,
a cold
wow.
plunge in it now. So yeah,
Nice.
a little
That's
different,
awesome.
but it's definitely the big thing down here, man. Everyone's doing cold plunge. So
Yeah. No, that's good. I mean, I haven't so far talked to a chiropractic slash functional medicine clinic that has a cold plunge in there. That's awesome. I would do it if I
yeah,
was there. So
yeah. Dude, we do like a membership, $100. People get signed up for monthly, and they just it's cool.
that's super cool. Yeah, I was researching your clinic, but I saw that yeah, one of your chiropractors does acupuncture. And
Mhm.
it looked like in one of the photos you had another either maybe they were a therapist or maybe they were just like management in one of your photos. Another gentleman.
Oh, that's my office manager. Yeah,
Sweet. Yeah.
yeah, the guy.
Awesome.
Yeah,
Yeah.
yeah.
Sweet. That's really cool. So I also like to ask an icebreaker question that's kind of out of the blue. If imagine that your medical practice was a superhero or that you were a superhero in medicine, what superpower would you choose to have and why?
Yeah, so I actually was listening to one of your other
Yeah.
shows and you asked this
Nice.
question. So I was kind of, prepared for
Good,
it.
good. That's a
It's
lot of
not,
people
it's
don't,
gonna,
and they're just like, oh God.
yeah, it's gonna be a little different than probably most people's answers, but
Oh,
mine would be Jesus, man. And that's because, I think he's the ultimate healer, right? And,
yes. Yeah.
yeah, so I am a Christian and we're a faith-based practice too. You walk in here and kind
Oh,
of the
nice.
energy and that, my hands are doing the work, but it's only because they were delivered, right? So, yeah, I'd say that would be it, man. Just
No, I mean, I think even from a non-religious perspective, like the the story of Jesus and what he did and just the way he carried on his life, I think that's something that every medical practitioner could hope to be as a light for their patients.
yeah,
Yeah.
that's right. Agree.
Yeah.
Yeah.
I think that's really cool. That's really cool. Um, wow, so you built this practice, this functional medicine practice. You have it looks like a little bit of like nutrition work in there. Did I see that as well?
Yeah, I do
Um,
some, blood testing and
mhm.
nutrition consultations, and we use a lot of supplements. So, definitely holistic approach as opposed
Yeah,
to the traditional Western medicine.
yeah,
When people get fed up with that model of just take medicine for this and then the symptoms that come from that, take medicine for that, it just doesn't work.
yeah,
So,
yeah.
yeah,
You're chasing something, but you're never really looking within at the real cause.
that's right. Yep.
Yeah. Also, how did you get into medicine? How did you start practicing?
Yeah, so I was always an athlete growing up,
Mhm.
and knick-knack injuries here and there, always going
Yeah.
to PT or the family doc, and I felt like it was always kind of like okay, but that made me want to like figure stuff out on my own too. And then it was probably more so in college where I was playing collegiate lacrosse and wanted to
Hmm.
optimize my performance and my health, and started getting into supplementation and the kind of biohacks. How can I hack my
Yeah.
bio, get better at stuff? But I always liked more of a natural approach. Um, and then it was actually after college, I had a pretty nasty shoulder injury,
Mm.
grade 5 separation. I mean, just gone.
Oh,
Shoulder
wow.
just totally tore up. Playing lacrosse, yeah, and had multiple surgeries, nerve damage, all kind of stuff. And
Hmm.
the surgeries went well. I was able to use my arm, but I just had this chronic lingering pain that I couldn't get rid of. This like
Okay.
nervy, itchy kind
Yeah.
of gone there, man, wouldn't go away. Starting to really affect my life. So I was referred to a chiropractor by a friend of mine, and I went and saw him. And I mean, within I want to say 6 weeks, pain free, full
Wow.
range of motion, function of the shoulder. We did laser chiropractic, some functional neurology, really cool stuff.
Hmm.
And I was like, all right, this is awesome. At the time, I was enrolled in PT school. I
Uh-huh.
was an exercise science major. I was going to go into PT school, and I totally rerouted to chiropractic. And
Wow.
yeah, that was the journey.
That's actually a really cool story because I know for again for a lot of people that experience PT had experienced chiropractic around this like a similar time. So it's actually really interesting that it took so long for you to get like referred or to see a chiropractor since you had already been doing PT, I'm assuming like high school, college, again, like
Yeah.
when you were in athletics. So like that's actually that's actually really interesting. It took that long, but then also the profound impact that had really shows the difference of the benefits of PT versus chiropractic. Like,
Yeah, man.
because again, a lot of people they go hand in hand, like one refers to the other, and it's like a similar timeline of that healing journey. So that's actually a really interesting take because yeah, like you were in PT school and like actually, especially for what you needed for your nerve pain, like and that nerve mind body connection that I think chiropractic really stimulates. Uh, that's phenomenal. And yeah, obviously like PTs are phenomenal as well, and especially with just the strengthening and the understanding of the different muscles, ligaments, how they move together and building that movement back up, and especially in extremities. Um, Very insanely beneficial, but awesome chiropractic story.
Yeah.
Yeah,
Nothing against PT, right? But it was
yeah,
like it wasn't working for me. I had done it, man, for months after the
yeah,
surgeries and stuff, and I wasn't touching it. And so I just was like, try something else.
yeah, definitely, definitely. And I had a similar situation with again like with headaches and like neck, shoulder, upper back strength, or is like, yes, we were strengthening the muscles, but underlying that were probably some patterns that just needed to be readjusted, to be kicked, to be, yeah, fired into gear.
Yeah,
Yeah,
right.
yeah, that's
Oh man.
awesome. So, do you focus on a particular demographic of patient or, yeah, like what are the demographics that you typically see in terms of like types of injury and or like focus of your marketing, or do you have a pretty general focus?
Yeah, I mean, I'd say we can help anyone honestly that comes in.
Yeah,
I treat some children, I treat some elderly people, but the typical chiropractic demographic tends to be people 40 to 60, maybe mostly sedentary. We do see a lot of active people as well.
hmm,
Tampa's a pretty kind of outdoorsy active
yeah,
place, especially lately. But we actually I kind of focus on multiple niches, and I think that's
hmm,
cool because we're able to target different needs,
yeah,
but under the same roof help people. And there's a lot of crossover. So, as far as like the marketing, I'm a corrective care specialist. That's what I do. Chiropractic biophysics, spinal curve restoration. That's our like my bread and butter, what I was
yeah,
trained on. But then we added spinal decompression for those nagging disc injuries. We added soft wave therapy, which is an awesome modality for extremities and nerves, right? So
Awesome.
sometimes someone comes in thinking they need one thing, and my job as a doctor is to be like, hey, let's try this too. I think this is going to help, or maybe this instead, right? And kind of
Yeah.
figuring out for them what works best and ultimately serving the patient in that way.
Yeah, and I think that's super important as a doctor. Medicine is always changing. There's always new techniques to learn, and it's not a replacement, again, like you said, for your bread and butter, for the thing that you know works for most people, but it's those outliers and saying, okay, if this isn't working for you, is there something that I've learned or something that I can use to help those patients I'm seeing actually like there's this demographic of patients that I see where it's like there's just something extra that they need. Like, what is that extra thing? And a lot of times we can also refer to other practitioners as we build our network, and access their tools, without having to, spend our entire lives in education. Uh, like
Yeah,
actually
that is
build a
right.
practice instead of just being at a desk learning for, all day. But
Right.
yeah, no, that's phenomenal. So basically mid-range demographic again, like a lot of times people that come to chiropractic, it's because they've built up these habits. I mean, there's either traumas or there's like the repetitive habits that we need to either find the root cause of and break those habits, or help them find healthy patterns to offset those habits. So yeah.
Yeah, and, we're seeing people in their 40s, 50s who truthfully should have been coming in here 10, 20 years
Yeah,
ago.
yeah.
But not until the problem becomes enough of an issue that most people are going to take action, right?
Yeah,
So I think that's like the biggest hurdle probably for us as chiropractors is that education piece around why you should engage in chiropractic, stretching, exercise, all these things
yeah,
preventatively rather than like, let's wait for something to go wrong and then take care of it. Because at that point, sometimes,
yeah.
there's only so much you can do. So,
Yeah, and that also tends to be the model in our country, at least right now with our healthcare system, and the culture
reacting.
around healthcare is like, if I have to pay out of pocket for it, I'm gonna wait until I'm like crawling.
Yeah. Yeah.
Yeah,
And that's the other thing, man, is so much like reliance on insurance, right? And so like these
yeah,
alternative therapies don't get the best coverage with insurance. And so that's a lot of what we talk about is how do we
yeah,
help people? And so we offer discounts and stuff for people when their insurance doesn't have coverage. Cause I'm like, man, are you going to do what's going to help your body or are you going to do what your insurance says you can do? Right. Cause those
yeah,
are two very different things and they're not
yeah,
all
they
for
are.
this. Yeah.
Yeah, I know, and it's hard, right? Because it's a great benefit to be in a network where people can find you because you take their insurance, but at the same time, it's also not very great that the insurance company gets to tell doctors what is allowed for their patients. So yeah, it's a struggle. It's a struggle on the different pressures of insurance.
It is.
Speaking,
Yeah.
yeah, speaking of struggles, what has been your biggest struggle as a practice owner, or some of your
Yeah.
biggest struggles?
Yeah, so I mean, I started this practice with business partners, which was great because they gave me a ton of knowledge and insight and were able to help me along
Mhm.
the way. The biggest struggle was when I bought the practice out and took it over full time as a 100% owner was
Mhm.
I didn't know what I didn't know, and so there was
Yeah,
some falls as far as and a lot of it did have to do with like collections and insurance and that kind of
mhm.
stuff, but luckily I was an associate doc for 2 years before I even got
Mhm.
into this. So I learned a ton and that was invaluable for me.
Yeah,
Um, and learning sales and how to position myself as that authority and how do I my biggest thing that I train my associates on is how do we lead that patient from the moment they walk in the door till their last visit with maintenance care, which hopefully never is, right? But like
yeah,
how do
yeah,
we lead them through their
exactly.
entire experience where we're always guiding them and ahead of them, not waiting for them to have concerns and questions, right?
Yeah,
So again, I think it's just like the learning process, man. And not even that it's been the biggest struggle, but it's just like time, right? How do you over
yep,
time continue to grow and become the expert?
yeah.
And by far I'm not the expert, right? I still am learning every single day, but
Yeah. But to a lot of people in their worlds, you're their expert. And again, there's always that next plateau to reach in terms of
right.
our knowledge, in terms of our ability to use our hands in healing. But yeah, you've put in the work to be the expert in a lot of people's lives and to be the person that can guide them. I think you touched on something really important there, which is the maintenance care, the wellness care. A lot of practices don't have systems for that.
Mm.
And I think it's huge, right? Because yes, you want to heal them, you want to help them with their traumas, with whatever the injury is or whatever the pattern is, but we always develop new patterns. Life is always happening to us. And so if you're a doctor that resonates with a person and they don't know and haven't really had the mental framework to think about their wellness, it's almost like a Hippocratic duty to say, hey, like, have you thought about what happens next? What happens after that? You know, how can
Yeah.
I help you in that journey? And sometimes, and a lot of times, the answer is going to be, I want to try it on my own. Again, from like normally from like a financial and time perspective, like everybody only has so much time and money and resources. So like coming into the doctor's office all the time. But again, just setting up a wellness plan that works for them or a maintenance care plan that works for them is huge for exactly for that reason, for them to not set into those old patterns. Or again, if they have a trauma that comes up, whether it's like a car accident or they fall off their bike or a sports injury, their body's going to be a lot more attuned to be able to recover from that if they've been on a wellness and maintenance journey rather than like, okay, I fixed the problem, I'm good for until the next like intense pain happens.
Yeah,
Yeah.
and we build that into the story from the beginning. I always say,
Yeah.
hey, like, I'm good at what I do. I'll get you 75% of the way there. I need 25% effort from you. Then on the back end of that, when we get into maintenance, it's more on you, less on me. But
Yeah.
you've got the tools that we've educated you throughout this process that now you know how to do these structural stabilizing exercises,
Hmm.
right? And it's very much like you go to the dentist, right, every now and then, but then you still got to brush your teeth, right? Like you got to do the
Yeah.
maintenance,
Yeah.
keep the teeth
I
healthy, or
love
else it's
that.
gonna rot out of your face, right?
Yeah. You can't just go to the dentist once a year and be like, well,
I'm
I mean, I
good.
don't have
Yeah.
a toothbrush, but
Yeah,
yeah.
exactly.
That's funny. Wow. So you built this practice, you purchased it from your partners full out and made it your own. You learned again what you didn't know. What's next? What's next for Alessi Functional Medicine?
Yeah, the goal would be, eventually to have multiple locations throughout
Hmm.
Tampa. We're doing something a little different too with I was kind of telling you that back room that we built into kind of like a
Yeah.
spa.
Yeah.
So I have a podcast myself called Full Fueled, and so we
Oh,
built
awesome.
this coaching kind of platform, my podcast partner and I, where we take guys who are mid 30s through fitness and that kind of stuff. So it's kind of separate from what we're doing here. But we built this recovery room kind of in tandem with that. And so the goal is to have a bigger facility one day too, where we can add more services, maybe add some massage therapists, make it kind of like I don't know, like a health mecca where people can come in. It's
Yeah.
like everything you need under one roof, pick and choose what you want to do kind of thing. So that's, that goal is probably the next maybe 6 to 12 months where we're going to start really trying to work towards that. So
Wow. Excuse me really quick while I write down that podcast. Fully
yeah,
fueled?
of course. Full fueled.
Full fueled. Okay,
Yes,
cool.
sir.
I'm really interested in it. I feel like, and also for any of the doctors or practitioners listening to this, just being able to see someone's journey through that health, right? That through that process. I mean, I'm in my mid 30s and I'm relatively active because I have kids, right? But I'm again, it's hard for me with the business, with the family, being a parent, like finding the time to fit in a habitual exercise routine. So I play around with things, but it would be awesome to have that support and also see other people's journeys around that same age group because I feel like that's when health really starts to matter in terms of the habits that you start to really integrate into your life is going to carry into your 40s, 50s, 60s. So super
Yeah.
cool.
Yeah, and
Um,
we preach muscle is longevity, right? If we have adequate muscle in our frame and
mhm.
we get to a fit, healthy life. All the guys in the program are dads, I'm pretty sure, and so it's a lot of community, which is what I think separates it from a lot of these kind of coaching programs out there.
Yeah,
A
yeah.
really cool community of guys who didn't know each other, and now they're on this online forum, and everyone's engaging. It's just really cool.
That is super cool. And so more of that, more of again, even more integrative medicine. And I talked about this on a podcast that's going to be uploaded soon, but we talked about the benefit of having all of those practitioners in one place
Yep.
on one EHR system where all of the notes are accessible to all the other practitioners because in that health journey, Like that can be a huge hiccup if you're sending stuff to a PT and it takes your office a week to get it there and it takes their office 2 weeks to record it and to get it in their system or however, like, there's always these pitfalls that can happen in communication with the patient's health. Yeah, and so the more practitioners you can have integrated into your clinic, I think it offers that extra benefit that patients don't have to get that frustration of waiting for care, waiting for communication between doctors' offices. Yeah,
Yeah, and it's all about what's the level of value we can provide to the people that need us and that
yeah,
service, and we're really good at that. And we actually even are bringing a nutritionist on to take over our weight loss program. So we had built out a kind of a natural holistic weight loss program to I want to say kind of to counter the whole Ozempic craze that's going on right now. Where like, let
mm-hmm.
me just take this thing that's going to help
Yeah,
me lose this weight, but it's not sustainable.
yeah,
So we've got this sustainable weight loss program. So I brought on a really good friend of mine who's a nutritionist to run that through our office. And so I mean,
wonderful.
we have pretty much anything people need, right, to get healthy and kind of
Yeah,
optimize their health, man. Yeah.
sweet, sweet. I love that. I love the vision, and obviously, good luck. Right, the next 6 to 12 months. I'd love to check back in. Also,
Of course, man.
I'll be in Florida in October, Lakeland, Tampa, Orlando area mostly. So let's catch up.
Let's
Maybe
connect.
go
Yeah,
grab a
let's
tea
do
or
it, man.
coffee. Yeah.
Love that. Yeah. What kind of
Sweet.
coffee do you like? What's your go-to?
I'm a tea guy, so I do herbal
Yeah.
teas and sometimes like white teas and yeah.
Yeah. People think I'm nuts. I'm black coffee all day.
Nice. Nice.
This is
That's
my
I mean,
personality.
if I was gonna drink it, I'd probably want it that way too. I
Right.
never got into it and it gives me
Gotcha.
like tension headaches if I, yeah, but
Yeah, it can
that's
be
just me.
stimulating for sure. Yeah.
Yeah. I don't think my body needs that stimulation person. So me
Yeah.
like as my individual body, yeah.
Right. Right.
Nice. So, last question on my end. If you could give one piece of advice to potential new practice owners or people stepping into maybe thinking about purchasing the practice from a group of partners, what would that advice be?
Yeah, I mean, most chiropractors, we are entrepreneurs, right? I 100% am an entrepreneur to the point that, I was in over my head, but I figured it out, right? You take
Yeah,
on debt, you pull credit cards to make it work. And
yeah,
so I think if you know in your core that you're an entrepreneur and that's your personality and you have the opportunity to do something and I say go for it. That's my biggest
hmm,
advice. Don't like think, well, I don't know, or I
yeah,
think you take the risk and do it, man, because there are people out there that need us, people that need, our expertise. And I think it's not there yet, but the country is shifting towards that in a way that
hmm,
the Western medicine there's things that it doesn't help with or it doesn't work. And that model is
yeah,
just kind of flawed. So, yeah, my biggest advice would be like, if you can help people and you're good at what you do, then you got to do it.
yeah. No, I think that makes a ton of sense, right? Like you touched on the model that is trying to be an integrative medicine model, but really it's a symptoms model, and that totally necessary in our society for traumas. Again, like think there's a place for it, but then they try to be an integrative medicine, they try to be a holistic medicine, and it doesn't translate over to what people really need in their life. And on the entrepreneurial spirit thing, it is a spirit. If you have it, listen to it. Yeah, listen
Yeah.
to it, let it guide you, dive in. It's uncomfortable, but also it's okay if that isn't your spirit, and there's still a place for you as a practitioner. But yeah, know yourself, dive in deep and know yourself. And if you have that spirit, definitely take the risk, follow it.
Yeah. I love it,
Yeah,
man. I agree.
sweet. Well, do you have any other questions for me? Any way you want to end the podcast?
Man, no, this was awesome. Thank you so much for having me on. Looking forward to
Yeah, thanks
connecting
for being
in
here.
the future. And if you're down in Tampa, we'll do something cool.
Hello, thriving practitioners. Ready to connect, learn, and have your voice heard? Join us in the heart of our community at the Thriving Practitioners Facebook group. Inside, you'll find a supportive network of like-minded professionals eager to share insights, strategies, and success stories. What's more, engage with us and ask questions that might be featured on our next solo cast episode. Find us on Facebook and request to join the Thriving Practitioners group on Facebook today. Let's build each other up together in the Thriving Practitioners community.
Welcome to the Full Fueled Podcast. I'm going to set what the new normal looks like in my life.
You're not limited by your genetics.
You have always superpower. that is lifting people up.
So unfortunately, most businesses aren't going to use the highest quality ingredients.
What's your approach?
Dude's jacked.
I know he's jacked. That's why I'm asking him what he trains.
I don't
bro.
think he lifts. It's consistency in everything that we do that really compounds.
Only way we're going to get the word out is with you. Live full fueled, live beyond limits, baby. Let's go.